Hello, I'm Betty Casey, editor of Tulsa Kids Magazine. We partnered with St. Francis Children's Hospital to bring you important health information for your family. You can find all of our interviews on our website and in the magazine at PJ's Corner, the little panda. Joining us today is Dr. Brandon Woods. He's a pediatric critical care doctor, which means he sees children in the pediatric intensive care unit. He attended medical school at the University of Texas Medical School, San Antonio. He served his fellowship at the University of Washington Medical Center and Seattle Children's Hospital. He was in practice at the Madigan Army Medical Center in Seattle before coming to St. Francis Children's Hospital. Dr. Woods will be sharing with us a new way of treating snake bites. So welcome, Dr. Woods.
All right, thank you. Appreciate it, Betty, for the introduction.
Okay. And let's just start with the prevalence of snake bites. Do you see a lot of snake bites in the pediatric ICU?
Thankfully, no, which is good. It's always good to be ready and available when kids need us, but it's great whenever they don't need intensive care. So looking at some statistics, Oklahoma-wide, we see about 350 to 400 snake bites on average per year. And of those, a majority of them do get hospitalized via a short period of time, and they're generally cared for in the pediatric inpatient service. And those that make it to the ICU, probably only a handful a year. So thankfully, we're able to treat it without needing a lot of intensive care, but we do have the capacity when and ready, and we're readily available whenever a child needs us.
That's good. My daughter told me that Oklahoma has a high rate of snake bites, but I don't know if that's true or not. She doesn't know.
Yeah, Oklahoma is rated 4th in the U.S.
Oh, is it? That's what she said. I guess she knows
4th in
what
the
she's
U.S., right. In our neighboring state, Arkansas is 3rd, so
okay.
we're among the top.
Well, we need to know how to treat those. So, when is the most prevalent time of year that you see snake bites?
Snakes like a temperature of 80 degrees, don't we all, but at least 80 degrees. And so typically you'll see snakes start to come out of hibernation in April, and the snake bite season lasts all the way through October before the temperature falls below 80 again.
I was curious about water. With all the rain and the high water that we've had, does that have any impact on snakes?
They do like a drier climate, but they will come out mainly based on the temperature.
Okay. So are there any prevention steps that you would recommend that parents take to keep from having their children be bitten by a snake?
Right, yeah, so the main thing is to stay vigilant. Vigilant with your eyes, vigilant with your ears. So don't step anywhere where you can't see what you're stepping on. Don't put your hand down and grab things that you can't see. And then if you hear things too that sound concerning for a rattle, then back up. The recommendation is to stay at least 5 feet away anytime you do see a snake, and that provides enough buffer in case that they don't decide that you are a predator to them. And we have to remember that snakes are afraid of us just as we're afraid of them. So they only generally attack if they feel threatened or as if we are going to harm them in any way. So wearing other things such as wearing closed-toed shoes. I know it's fun to hike in sandals and other things like that, but just having closed-toed shoes and even boots may be beneficial if you're going to an area that has more snakes. And then a walking stick is great. It also provides a barrier for you to have a little bit more time and get away should you see one.
Mm-hmm. Yeah, good advice. Yeah, because a lot of times we're in the heat and we don't want to wear closed-toed shoes or boots or long pants, but that could protect us from a snake bite. So
correct.
I know that not all snakes are venomous. Which snakes are the most dangerous in terms of venom that we might encounter?
Sure. In the U.S., we have 2 families of snakes that are venomous, the pit vipers and the coral snakes. Within the pit viper family are the rattlesnakes, copperheads, cottonmouths, or water moccasins. Those are the ones we commonly see here in Oklahoma. And these snakes have a venom that can affect mainly our muscles and our ability to form clots in our coagulation cascade. So those are the ones we typically see here. There are some reports in the U.S. of coral snakes. Those emit more of a neurotoxin, but generally those are much less rare and much less common, more rare here in Oklahoma.
Mm-hmm. Okay. We hear about anti-venom. What is it and how effective is it?
Yeah, so we've been able to develop immunoglobulins or antibodies against toxins and venoms through a variety of research techniques, and actually been able to develop it both for pediatric and adults. So we take this immunoglobulin and the four most common types of snakes and develop an antitoxin or antivenom against them. That allows us to circulate these antibodies and neutralize the toxin that is in the body that is released from the venom. So with this antivenom, we're able to treat usually a couple of doses, and we see mitigation of the systemic effects of the venom.
Okay. And then
it does require an IV. It does require some observation, and it's only available in emergency departments and emergency facilities across the state.
If I'm going to ask you about how quickly we need to get children in to see the doctor later, but I understand that St. Francis is using a new treatment. Could you tell us about that?
So yes, generally kids will present to the emergency department and they'll get the antivenom started there, and that does a great job of mitigating the effects of the toxin. Sometimes the systemic effects of muscle breakdown, tissue breakdown, those kind of toxins can affect our kidneys, our ability to form clots, as mentioned. And if a child is systemically ill with this, we are able to do what's called therapeutic apheresis in our pediatric ICU that allows us to both remove some of the toxin and dilute the effects of it. So you often hear that sometimes the solution to pollution is dilution. So we're able to kind of decrease the overall effect by diluting it throughout the body. Additionally, we're able to remove it as best we can through this therapeutic apheresis or plasmapheresis. So the best way to describe it is like we're giving the body an oil change. So we are able to, with the placement of a catheter, take out blood, and through a centrifuge at a certain rates of speed, we're able to separate components of the blood into plasma and pull off the plasma that likely has all the toxin from the snake. We then pull that plasma off and then discard it and give them back either plasma or an albumin substitute back into their body. So with time, hopefully this venom and toxin effect is mitigated, and both their kidney function can improve, as well as their muscle breakdown and their clotting cascade is restored back to normal. And so we're able to kind of rid the body by doing this kind of oil change technique that restores the body to normal function. So it does require.
Well, so if you're using that new, to understand, if you're using this new treatment, is the patient less likely to have long-term effects from the venom? Okay.
That's our goal. So once we start to see systemic effects that is not being treated just with anti-venom alone, we will place them in our ICU and do this therapeutic apheresis technique. So this technique is used for other toxins and other indications for kids who have difficulty with their clotting cascade or have been exposed to other toxins too. And again, we reserve it for those they're having multiple organs involved and are very severe in illness. But it's nice to have the capability to do it whenever they need it. So we do place the catheter here at bedside. It's all done within our pediatric ICU, and they're monitored throughout the entire time for vital signs and any other abnormalities that they may develop. And then the whole procedure takes a couple, 3 to 4 hours.
Okay.
Sometimes we have to repeat it a few times. So 2 to 3 rounds of this apheresis technique before we start to see beneficial effects. But we can do that multiple times with the different techniques we have available here.
Yeah, sounds like a really useful thing to have. Okay, my final question is, if your child is bitten by a snake, what steps should parents take? How quickly do they need to get them to the emergency room or to a doctor? Do they call an ambulance? What should parents do if, say, a child has been by a copperhead?
Sure. I think all kids should be evaluated as soon as possible. The hard part is that often these are remote areas that help
Yes.
is not readily available, or the nearest emergency department is far. So things that we recommend is one, getting to emergency department as soon as possible. Two is to just let the bleed naturally. Don't apply a tourniquet or any sort of restrictive device. Oftentimes kids are bitten on their hands or feet or extremities, and so let it bleed. Don't use a lancet or a knife to poke up any blisters or swelling that happens. Just to cover it with gauze, and then seek care. You're welcome to call 911. That they may provide further guidance. There's also a great number to keep memorized for kids for any type of poison or toxin, and that's our Poison Control Center. And so that is a 1-800 number. It's 1-800-222-1222. And so anytime your kid has an ingestion of a substance they shouldn't have, or a toxin or a bite, that is a good number that they can give you advice. It's managed by a regional toxicologist, so they know exactly what advice to give you. These are things you can do while you're in the car or on your way to the emergency department. The number one thing is to stay calm. So we often, when we fly, put on your oxygen mask before helping others. Kids feed off of that. So if their parents are calm, they will also be calm. And helping them stay calm, that they will be okay. It's just we need to seek help. Will help them overall get the appropriate care that they need in a quick time manner. So if the snake is killed by any means, and have an ability to take a picture of it, that is great. It helps kind of identify, but we wouldn't recommend going to getting closer to the snake in order to just get a picture. We'll be fine. But if the snake happens to no longer be living, then taking a picture may be beneficial.
Okay.
It's also helpful if you have any sort of restricted devices on the hand or extremity, such as if they're wearing a watch or a wristband, or kids have a bunch of bracelets these days. So if that's on the hand that's involved, to go ahead and take that off, as we do expect further swelling to develop as the toxin takes effect. So getting that article of clothing or wristband off while you're seeking or driving to emergency care, that would be beneficial to us as well.
Okay. So no tourniquets, no cutting, so those are the TV things that you see in way long ago.
Yes.
So none of that. We don't do that. Okay.
No, that's not we don't try to exsanguinate it ourselves. We just let it bleed and cover it with what you have available. You're also welcome to use irrigate it with water or a little gentle soap to try to kind of dilute the effects of the toxin. That also helps, but mainly just keeping it covered and seeking emergency care.
Okay. Call a professional, get the child to a professional. Don't do it yourself.
Don't do it yourself. And
This
realizing that they may get an IV formulation of the anti-serum, and if that doesn't work, we have therapeutic techniques in our pediatric ICU to further help them.
Great. Okay. This was such good information, Dr. Woods. So I really appreciate your time today. And again, if you want to see more interviews like this, you can go to tulsakids.com. And we so appreciate St. Francis Children's Hospital. And thank you again.
Thank you. I appreciate the opportunity.